Oh, hey, didn't see you there. Let's talk about pregnancy and birth during the time of COVID. I'm John from Fathercraft, and I know stuff, but I'm not a doctor, so we found one to tackle this topic we know is on the minds of expecting parents. Dr. Jacqueline Winkelmann, aka Dr. Jacq, is a board certified pediatrician. She's a pediatric hospitalist and the former chief of staff at the Children's Hospital of Orange County. Dr. Jacq is currently the medical advisor at Miku, one of our favorite baby monitors. So thanks to the team at Miku for making this conversation possible. We talked with Dr. Jacq on September 18th, 2020. We hope you enjoy the conversation.
Dr. Jacq, thanks so much for coming on. Can you tell us who you are and what you do?
Sure. Thank you so much for having me, first of all. My name is Jacqueline Winkelmann. I'm a board-certified pediatrician and former chief of staff at Jacq Children's Hospital in Orange County in California. And I've been on staff there for about 20 years, but most recently started doing some consulting work. And I'm currently the chairman of the medical advisory board for Miku, which is a baby monitor company.
So what is the science looking like today in terms of what happens if you get COVID during pregnancy?
Well, first, let me start by saying that there's not a ton of science yet because this is very much an evolving thing. We're learning every day more and more about COVID. And of course, the pregnant population has always been a very special population. So as far as research and things like that, it's always just a little harder to get massive amounts of data. But in general, with respiratory illnesses, we expect pregnancy to put you at a little bit more of a higher risk of complications. With COVID, there was actually one recent study that showed that, yes, in fact, pregnant women are slightly increased risk of being admitted to the ICU, for example, or even needing mechanical ventilation. However, the mortality rates were the same as the general population. And with that said, the same study also showed, not surprisingly, that the highest risk population are going to be minorities, Black, Asians, and Hispanics.
And have there been any studies yet on if the mother gets COVID during pregnancy, whether that has any impact on the baby's health?
Yes, mostly anecdotal, but it seems to be very rare. So that's good.
Excellent. So kind of moving into the actual birth and being at a hospital, what are some of the biggest differences between what expecting parents should expect during birth pre-COVID and during COVID?
Yes, actually it is quite a different experience, and it has evolved even, from March until now. Used to be much more strict, but basically the difference is going to be different protocols at the hospital for especially number of visitors allowed, how long a mom and a baby will be staying in the hospital, mask wearing, and things like that. But every hospital has a different protocol, every city, every state. So it's important for parents to find out, especially as they get closer to delivery, what is the status of their hospital. Because again, I can tell you that in March, April, May, sometimes some hospitals didn't even allow a spouse to be in the room during delivery because there was just so much that was unknown about the virus. Now, certainly, your spouse, your support person is allowed to be. But for example, if you are going to have a doula, you need to make sure that that is not counted as an extra visitor, and that person will be allowed to be in there as with your spouse. So it's important to just know ahead of time what you're getting into.
Yep. And I think you just gave part of the answer to our next question, which is what should expecting parents do to prepare to make this experience easier?
Yeah, so I think the biggest thing is managing expectations ahead of time. I think that's what will make the process so much more enjoyable and the way it should be, especially if this is your first child. So again, equipping yourself with having the most accurate information about what your hospital policies are going to be is going to make it so much better. And then you can prepare yourself during pregnancy by taking care of yourself, trying to avoid risky situations and, the common sense, hand washing, mask wearing, avoiding large gatherings, that type of thing, so you can stay healthy for your baby ahead of time. That's something that you can't control.
So we've talked with a couple of couples who have given birth during COVID, and there was a kind of unexpected benefit to this for a few of them, which is that they got to spend that time with just the three of them, and they didn't have to worry about, 500 people want to come and visit immediately.
Yes, things definitely look a lot different. You don't have the big room full of people and visitors coming in and out to see your baby all the time. But that has definitely been an upside, not just for the families, but for the staff, because it's just a lot of traffic to manage in a kind of a higher risk part of the hospital. And during flu season, we're always concerned about numbers of people in the hospital. So, but having that quality, uninterrupted time with your baby it's pretty cool, and it doesn't come that often.
And what are the biggest things that health professionals are thinking about right now with all of these changes?
As far as childbirth and delivery, you mean?
Mm-hmm.
Yeah, I think, again, we learn something every day. We get more data coming every day. And we just, I think this is something important to think about when you are pregnant or having a baby, is the fluidity of this whole thing. Because I think the unknown is so scary. Like you said, especially for new parents, the unknown of this whole experience, it can be quite overwhelming. So rules changing and things, science changing can be very, disconcerting for a lot of families. And so I think healthcare providers need to emphasize that things will change, but it's okay, because the more data we have, the better we can serve our families and the babies. So that's kind of what we aim for. It's just, transparency, keep people informed of what's happening. Every area is different. So what the COVID rates are in your area are significantly going to change what's happening in your hospital and, and outside of that world.
Are there any websites or resources would you recommend new parents go to get those updated guidelines or that updated information as it evolves? Because being a social media heavy society, you never know what you're looking at. So are there any reputable places you recommend?
Yes, there's a lot of information out there, and it's not all validated. Let's put it that way. So I would actually encourage parents to go directly to their primary healthcare provider, to their OB-GYN and to their pediatrician, because they're the most in touch with what's happening in your environment. And so they can help guide you the best as far as, protocols to follow and things to be concerned about in your area, because it's kind of irrelevant to, go on even reputable, Mayo Clinic sources if you live in a completely different environment. That's one thing that we've noticed with COVID is how, the wave has moved through the country, and, places that saw no cases in March were exploding now, et cetera. So I think the most accurate information is going to come from somebody that's near you.
I think that's such good advice, and it's almost counterintuitive that, someone like the Mayo Clinic or the American Academy of Pediatrics, although they're giving great overall advice, they're having to look at the, entire span of the country.
Absolutely, yeah.
You already touched on one of these, but, there are certain things you can control in this situation and certain things you can't.
Yes.
What are the things that you can control as an expecting parent and you should be thinking about?
So it's a good question. And, what you can control is how you take care of yourself, following up with these, doctor's appointments, making sure that you're prepared, that you have, for example, something you might not think about is having a 30-day supply of prescription medication. The one thing you cannot control for the most part is when your baby's going to come. So you want to make sure that, you have ample supply to those very important things. Your baby bag for the hospital is going to have a few different things this time. It's going to have more hand sanitizer. It's going to have wipes. It's going to have, masks, that type of thing. So those are the things that you can do to prepare. And again, the more information you have, the better your experience will be, because it's all about managing expectation. And if you know what you're going into, then it can be a completely joyful experience. Like you said, some parents are finding that there are some benefits to delivering during the time of COVID. So I don't think it has to be this, this mentality of fear and, and being terrified. I know there's a lot of anxiety regarding, are my family members going to get COVID before the baby comes? Are we going to get COVID in the hospital? It's really ironic because at the beginning of the pandemic, hospitals were ghost towns unless you were in an epicenter, right? Not in New York at the beginning, but here in my area, I mean, the hospitals and the emergency rooms were completely empty. It was probably the safest place to be as far as getting COVID. You know, we have all the protocols and no patients. So, you know, informing yourself of what's going on in the place that you're going to deliver, I think is the best thing you can do to prepare. Because, like I said, the things you cannot control is when your baby's going to come, you know, what happens, you know, what the COVID situation is in your area, you have no control over. But the more that you inform yourself and prepare yourself, the better off, you know, all go.
Excellent advice. And any other guidance or advice that you have for expecting parents?
Yes, I think one of the things that a lot of parents are wondering, and this came up especially in the beginning, is should I be going to my doctor's appointments? Should I be delivering my baby in a hospital? And again, the American College of Obstetrics and Gynecologists highly recommends that you still deliver your baby in a hospital or a certified birthing center, because emergencies and unforeseen situations will happen. And you want to make sure that your baby has the best chance. So while there's all these anxieties about going to the hospital, or even, you know, now with telemedicine, I think, you know, following up regularly with your OB as you were supposed to normally, it's made a tremendous impact, because a lot of the visits can be done by telemedicine, but that way you can still connect with your primary care provider. You can ask questions. You can see how things are changing as far as protocols for the hospital. But at the same time, knowing that this is still the best place for you and for your baby.
Wow, that was awesome. Thanks again to Dr. Jacq for answering all of our questions. If you like this video and found it valuable, make sure to subscribe. And also check out more from Dr. Jacq and our 2 other videos with her on pandemic parenting and baby sleep. Thanks again to Miku Baby Monitors for making this possible. You can learn more about Miku by checking out the link in the description below. And for more with Dr. Jacq on baby sleep, you can head over to fathercraft.com/sleep.